Good morning, everyone. We have started with the topic that is pharmacoeconomics. So, new point that we are going to study today is about pharmacoeconomic evaluations. Okay. So, all pharmacoeconomic evaluations are based on answers to two basic questions. So, the first question is, are there two or more alternatives? And the second question is, do the interventions examine cost and health effects? Based on the answer to each of these questions, a classification of pharmacoeconomic evaluation studies is developed and presented. So let's see what is that classification. So first, if only one treatment or drug or program is examined, then it is simply a descriptive analysis of the treatment, drug or program, and hence it can be classified as partial economic evaluation. Okay. Then second is, if the pharmaceutical program evaluation consists of two or more alternatives but limits itself to a discussion of cost or effects only, then this type of study is also considered a partial economic evaluation. However, the third one, if a PE evaluation comprises a comparison of two or more alternatives and attempts to link both cost and effects, then these evaluations are considered full economic evaluation. So let's see what are the difference between these three. That first one, it talks about either treatment, program, or drug. Okay. And when we talk about only treatment, drug, or program, it becomes just the descriptive analysis of the treatment, drug, or program. And when we have only the descriptive analysis of this, it becomes only the partial economic evaluation, as we are only talking about the treatment or drug or program. In second case, we have selected the program. We are focusing upon the pharmacy program. But and also we have the two or more alternatives in our hand, but we are only limiting to description of either the cost or the effects of that particular alternatives. We are not linking the cost with the effects or the outcomes of those alternatives. We are only dealing with either of the criteria, either the cost or the effects of that particular pharmacy, that alternative. So it also becomes the partial economic evaluation. But what is a full economic evaluation? In this full economic evaluation, we have the alternatives and we are trying to link the cost of the alternative with the outcomes of it. Okay. So it becomes the full economic evaluation. So next is, this is the elaborative chart of that only, that does it examine two or more alternative. So whatever economic evaluation we are carrying out, we are talking about it only. So if does it examine two or more alternatives, there can be two answers. That is, first answer is yes and second answer is no. So if answer is no, then what happens, that we will see first. So does it examine cost and health effects? So if it examines cost only, then it is nothing but called as cost description, that is cost of illness. If it describes effects only, then it is nothing but the health description. And if it examines both, that is cost and effect, then it is called as cost outcome description. Okay. So if answer to this question, that is, does it examine two or more alternatives? If it is yes, then next question comes or arises is, does it examine cost and health effects? Then if it examines cost only, then it is cost analysis. If it deals with effects only, then it is efficacy and or effectiveness analysis, that is QOL studies. And if it examines both, that is cost and effects, then we have various different type of methodologies which we have earlier enlisted, that is CMA, then CBA, then CEA, then CUA, and CCA. We are going to study it in details in next few slides. Okay, so what are the types of cost then? Then there are four main types of cost. First one is those incurred by the health sector. Second one is those incurred by the patient and the family. Then third one is external cost, and the fourth one is productivity losses. Okay, so let's see one by one the cost, the type of cost. The first one is cost incurred by the health sector. Please remember this, it is represented by C1. Next, in next few slides we have certain equations there, we need these particular symbols. So cost of providing care by program, that is organizing and operating cost within the health sector, as well as cost of continuing care such as treatment of infection or side effects. It may include direct costs such as overhead capital, and variable costs such as drug cost, laboratory tests, and the physician visits. So in this cost incurred by the health sector, we may have direct cost as well as indirect cost. Sorry, not indirect cost, variable cost. So second type of costs that are incurred by the patient and family, and it is represented by C2. So it includes direct costs such as out of pocket cost, co-payments, travel cost to hospital, cost to accommodate the patient, and the time consumed by the patient and family receiving the treatment. So it doesn't have any variable cost. Then third type of cost which we have here is external cost, and it is represented by C3. So this category includes all resources consumed in other, that is non-health sectors, items such as resources consumed by volunteer sector, then church kitchens, then homemaker services, etc. are included here. Okay, so these are like other costs which are not directly related to the patient or the health sector or the hospitals. It is totally external to them. Okay, the next is productivity losses, and it is represented by C4. So inclusion of indirect cost or productivity cost due to loss of leisure or work time due to sickness is appropriate only in some circumstances. Okay, so like if you are on a job and you feel sick, so in that cost, in that case, you will take leave for a few days. Okay, so when you take leave for few days, it is loss to the company for whom you are working. So somewhat productivity is lost in that case. So that type of cost will come under this, that is productivity losses, that is C4. Then we have the outputs over here. Outputs or outcomes. So economic or monetary outcomes, that is reduction in a resource use or savings, is included in this category. So this may accrue to the healthcare sector, that is S1, then patients and family, that is S2, then non-health sector, that is S3, we can say external to the healthcare sector, and the fourth is productivity gains, that is S4. This may include savings due to treatment, that is direct monetary benefits, as well as production gains to return to work, that is indirect monetary benefits. Okay, so production gains to return to work means what? If patient who fell sick, he will take some day leave. If he gets better earlier, then he can return to work uh, at early as possible, so that productivity increases. So that is productivity gains, that is S4. So clinical outcomes or physical effects, it is represented by E, which is equal to changes in physical effects in natural units. For example, lab values, slash of hashtag of life saved, hashtag of deaths averted, hashtag of disability days reduced. Okay, so H is humanistic outcomes, V is changes in other values not necessarily related to health, such as process of care, information received, and the reassurance. U indicates changes in quality. What is quality? Quality is quality adjusted life years based on valuation of health state preferences. Then W is willingness to pay or contingent evaluation, and W dash is a global willingness to pay, which includes all outputs listed above. Okay, so we have different methodologies, and these are the calculations of it. That is CMA is equal to C1 minus S1, or it can also be given as C1 plus C2 plus C3 plus C4 minus S1 plus S2 plus S3 plus S4. So CEA, it is given by C1 minus S1 divided by E. Okay, so what is E? E is this, that is clinical outcomes or physical effects. So C1 minus S1 divided by E, or it can be alternatively given as C1 plus C2 plus C3 plus C4 minus S1 plus S2 plus S3 plus S4 divided by E. The next methodology we have, that is CUA, that is C1 minus S1 divided by U. Okay, so U is here, that is changes in calling. So U, or alternatively it can be given as C1 plus C2 plus C3 plus C4 divided by U. Then we have CBA, it is W dash minus W dash is global willingness minus C1 plus C2 plus C3 plus C4, or it can also be given as W plus V plus S1 plus S2 plus S3 plus S4 minus C1 plus C2 plus C3 plus C4. And CCA, that is cost consequence analysis, it lists all the relevant parameters in an array format. Okay, so no need to remember this all the formulae which are there over here. It is just for your reference. So the types of outcomes which we have over here, that is three types of outcomes. That is, first one is clinical outcomes, second is economic outcomes, and third one is humanistic outcomes. So what are clinical outcomes? That is final mortality examples, that is number of deaths or lives saved, then life years gained, and cure rate. In case of morbidity, strokes, myocardial infarctions, days of hospitalization, and days of disability. Then intermediate clinical outcomes which we are looking upon, that is mortality, examples of it, that is cases which are identified, and response rate. And in case of morbidity, the blood pressure, serum cholesterol, drugs correctly prescribed. Then economic outcomes, that is first one, there is no final or intermediate outcomes over here. All of these are the final outcomes. It consists of utilization of health resources, examples that is hospital days, physician visits, medications, and services such as nursing or food delivery. And the non-monetary outcomes, that is absenteeism, job changes, time for returning to work, and the productivity gains or losses. And the humanistic outcomes which we have over here, that is intangibles. That intangibles, so we have the objects as tangibles and intangibles. So intangibles, we cannot actually feel or touch these objects. Okay, so how you feel today, we can express how we are feeling today, but we cannot actually show that this much happiness I am feeling, this much sadness I am feeling. Okay, so that is intangible thing. Your feelings are intangible. Okay, so that are the humanistic outcomes. Then quality of life, and third one is utility, including quality. So the perspectives which we have over here is, the first perspective is patient perspective, then second perspective is hospital or physician perspective, third perspective is employer or society perspective, and fourth perspective is the third party pair. So in patient perspective, we have clinical cure, quality of life, out of pocket cost, satisfaction with treatment processes. So I have told you about these perspectives. So depending on perspective, the economic analysis are to be carried out. So if it is patient's perspective, then economic analysis variables they differ. If it is a hospital or physician perspective, then the variables they are different. Okay, so hospital and physician perspective, it relates to the clinical cure and the profit which they may obtain from the treatment. Then employer or society perspective, it is again deals with the clinical cure, then the cost which is occurred to the employer or society for treatment of that disease, and the productivity losses or gains after treatment to the disease. Okay, then third party pair, again it deals with the clinical cure, then cost to the third party pair, and the customer perception of the value. Okay, so, in the formula which is provided to link cost and outcomes for the purpose of using various PE techniques, it should be noted that the perspective adopted in conducting such analysis plays a major role in what is included in the cost or outcome side of the equation. Okay, so depending on perspective, the formula may vary. Okay, so perspective is an important consideration in P because cost and consequences, and thereby the results of the P evaluation, can differ based on whose point of view is taken. So if you consider the perspective, I will give one example. When patient gets hospitalized, then it is revenue loss to the patient, but it is revenue gained by the hospital. So here there are two perspectives. One perspective is of the hospital and other perspective is of the patient. For the patient is the money that are being debited from his account, that he has to pay to the hospital. So the perspective is the value or the money is going out in view of the patient, but in view of the hospital, the money is what is getting credited to their account. So for hospital it is all the gains that they are incurring. Okay, so there are no rules for which the correct perspective to select, although societal perspective is preferred because its broad implication. Okay, so as we have studied the four perspective over here, uh, we cannot exactly decide upon that which perspective we have to actually select. Okay, but most probably we go for the societal perspective, that is the keeping society in mind. We have to use that perspective because it has broad implications. Okay, so if we see only patient perspective, then the focus is only limited. If we see hospital perspective, then the focus is limited. But when we seeing the society at large, then it becomes, or it has a very broad implications. Then it is possible to select more than one perspective, but that is not usually done because it increases complexity and confounds the decision making process. Okay, so perspective selection is done, and we have to we must go for the societal perspective. It is possible to select multiple perspectives, but we should not do that as it increases the complexity of the study. Then let's see what is patient perspective. That is all the relevant cost and consequences experienced by the patient, and includes the cost such as direct cost, indirect cost, and the intangible cost. Then next is provider perspective. It is one of the primary uses of, of pharmacoeconomics in clinical practice, is to aid clinical and policy decision making. So complete pharmacotherapy decisions should contain three basic evaluation components. That is, first component is clinical, second is economic, and third one is humanistic outcomes. So concerned with the expenses of providing products or services. So that is the provider perspective, and it includes cost, that is only the direct cost. So payers perspective, society, social security or government, third party payers, for example private insurance companies and employers. So it is the payers perspective. So the third party payers, when we talk about it, are these are the insurance companies. Okay, so whenever you do some kind of mediclaim and you get hospitalized into certain hospital for certain sickness, then it is the third party payer who is concerned with such a hospitalization, as they have to pay for your hospitalization. Okay, so it includes the costs such as the direct cost and the indirect costs which are relevant to the employers, lost work days, then lost productivity at work. Okay, so indirect cost, because productivity we cannot measure, we it is intangible. Okay, so productivity lost if you don't go to work for a certain few days, then it is loss of productivity to the employer. So we cannot exactly measure how much productivity is lost. That's why it comes under the indirect cost. Then societal perspective is, it is broadest of all perspective that comprehensively evaluates all costs and the consequences. So it considers benefits to the society as a whole, and it includes the cost, that is direct as well as indirect. So what are direct costs? That is overall cost of providing care to the patient, and also indirect costs include, that is loss of productivity. So same as the employer. So methodologies of the pharmacoeconomics, five basic economic pharmacoeconomic study. We are going to study it in next lecture. We will finish over here, and this is the most important point of the pharmacoeconomics, and we will study it in detail. Okay, thank you.